Good evening and welcome to our Monday special town hall, coming to you this time from the county of Kirinyaga, county number 20. Small in size, only just about the third or if it's fourth smallest in the country, but very many respects it's much bigger. It is in fact the county that shares a historical background with the name of the country itself, but Kirinyaga County also has impressive health statistics here. As a matter of fact, now it is beginning to deal with lifestyle diseases such as diabetes, cancer, and even obesity. That means that many of the basic health problems here are just about sorted, but we have a crowd here that is going to have a say on that. But tonight we have several leaders that have gathered here to help us begin this conversation that we have here every Monday night. And I'm just going to introduce my panel tonight before I come to the crowd. And first online is Peter Ndambiri, who is the Deputy Governor of Kirinyaga County. Please help me to welcome him onto the stage right now. Karibu sana. Next, we will have Dr. Agnes Gachoki, who is the CEC member in charge of health, also from Kirinyaga County. We also have on the panel tonight Eliud Muridhi, who is the Commercial Director of Kenya, that is the Kenya Medical Supplies Agency. And last but not least, we have Emma Waithera. Emma Waithera is actually a women activist here in Kirinyaga County, coming to bring on board the voice of the community. We also have the crowd here that is all charged up to get ready with the conversation, and my colleague Mashirima Kapombe is standing by to speak to some of them to get the expectations and also to get us started. Kapombe.
Naam, hapo sasa Jo, ikiwa ni kaunti ambayo umeitaja sawa kuwa ina kilomita mraba 1400. Pia katika huo udogo wake ama sijui ni ukubwa wake kuna vituo vya afya 64 ambavyo ni vya serikali. Lakini swali ni je, kama kuna hivi vituo vyote katika hii nafasi ndogo, mbona wenyeji wanalazimika kusafiri hadi katika hospitali ya rufaa ya county kupata matibabu? Wenyeji hapa watakuwa wanatupatia majibu hayo, na pia wana maswali kwa viongozi wa county na maafisa wa KEMSA waweze kupata majibu kuhusiana na jinsi afya bora kwa wote itaweza kutekelezwa katika county hii. Lakini kama kawaida Jo, nilikuwa tu katika pita katika county hii ya Kirinyaga. Anthony Mushiri's day as a community health volunteer in Kirinyaga County involves a lot of walking and talking.
Hello boss. Vipi? Naitwa Mushiri. Na venye nafanya analejisa NHIF.
Mushiri is one out of over 1,000 community health volunteers working to sign up residents onto a health insurance to avoid out-of-pocket payments in line with the universal health coverage agenda.
Nenda mlango kwa mlango kwa kila mtu ili tupate kila mtu. Na sababu ya tuende nyumba kwa nyumba ni vile watu wengi hawajakuwa registered. Na wenye walikuwa registered wengine acha kulipa.
He uses a smartphone provided by the county government where he fills the details of those yet to register.
Kwanza kuna wengine bado ukataa, lakini kuna wale wanaelewa.
We have healthcare workers, 100 of them, 5 in each of our 20 wards, with smartphones and an application that is able to capture the socio-economic status of every household. Right now we have approached around approximately 56,000 households.
The county referral hospital is at the peak of 64 government health facilities spread over the 20 wards in the county. These include 37 dispensaries, 23 health centers, 3 sub-county hospitals, and the 1 county referral hospital in Kirugoya. But just like in many other counties, the referral system here is experiencing major challenges. Most residents prefer to come all the way to the county referral hospital, no matter the nature of sickness.
The county, the price itself is cheaper more than the other facilities. Still, on the terms of medication, they believe the county provides the best.
If you are near the border between Kirinyaga and maybe Embu or Nyeri County, and there is a facility maybe on the other side, but which is near than the facility on the Kirinyaga side, it won't be appropriate for your health-seeking behavior, you will not decide that I will go to the Kirinyaga site, which may be far. You need that service. So it's a matter of understanding that healthcare services cannot be politicized.
Mary Wanjiko is one of those mothers. Here she is in the Kangaroo Mother Care Ward with her preterm baby. Penina Nyawera is another who has given birth at the County Referral Hospital for the third time. Her home is a distance away, but she left all the health facilities near her to come here.
Kwa sababu napenda hii hospitali na wakati wote nimekuja huku nimehudumiwa vizuri.
At the Pediatric Ward, 70% of the children admitted are being treated for pneumonia, a prevalent disease in Kirinyaga.
Majority of the respiratory infection, even to the extent of pneumonias, can be comfortably managed from a dispensary, from a health center, from other lower level facilities. So it's only the severe cases that warrant admission.
Kirinyaga County is increasingly having to deal with what experts call non-communicable diseases such as diabetes and high blood pressure, partly attributed to the people's lifestyles. Only a third of the patients seeking services at the referral hospital are registered under NHIF, a key ingredient in the Universal Healthcare Plan. And volunteers such as Mushiri are in a race against time as the country seeks to realize one of the items on the government's Big Four agenda. Mashirima Kapombe, Citizen TV, Kirinyaga.
All right, so a snapshot there of how the health situation here is here in Kirinyaga County, and we will just start right away with the panel here. Bwana Deputy Governor, lots of work going on in upgrading medical facilities. Actually, the governor spoke about upgrading the county referral hospital in Kerugoya to a 500-bed hospital, doubling the capacity and all of that. But we've seen that many residents of this county still prefer to go there, even though there are 60-odd facilities out there in the county that they could be going to even for small ailments. So the referral system clearly does not seem to be working. Why is it that people are not getting treated where they live and they choose to travel all the way to Kerugoya from all parts of this county?
Thank you so much, Joe. I would want to say that much of what concerns Kenyans is more of perception. You know, somebody may think that the best doctors are from Nairobi Hospital or Kenyatta Hospital. Now that Kerugoya Hospital is our referral center, you see people with ailments that can be treated in our health facilities and dispensaries still opting to go to Kerugoya. And one thing we do is that they cannot be turned away. Otherwise, those who are used to going to the centers really get the health support that they require. But because of the perception that the best is in Kerugoya, and which is a referral hospital, we have no choice.
But that perception is not totally unwarranted. I mean, there are many people who will tell you in this country generally that public hospitals, whether it's a small dispensary or whatever, that usually you wouldn't get the best service. Do you think these people are just running away from those places because of perception, or has there been a history of people going and not finding
There
things?
has been histories whereby there has been lack of medication in our small facilities like health centers and dispensaries in the past. And now for the Mwananchi to know that what is being offered is good, it will take time. Otherwise, right now, I can assure you, and we have cases whereby people are saying that even in our dispensaries, there is better dispensation than any other private facilities.
Okay, in a short while, the residents of this county who are represented here will have a say on that. But Madam CC, I would like to come to you, Dr. Gachoki, sorry. This county is rather different in some respects because it is leading countrywide in cases of obesity, depending on which school you went to, second in cancer, and even in diabetes, it is number 3 according to a certain study that I saw. These are fairly uncommon health challenges in many counties in this country. What is different? What is the problem with this county from a health perspective?
In actual fact, I think what I would say is that, Joe, our kind of population is very different from maybe many other counties. And we are now seeing more commonly than before those diseases that were thought to be the diseases of the rich. Now even getting even the people who are perceived not to be rich, or rather those who are perceived to be living in the rural areas. I would point out at a few of our maybe behavioral habits. One of the key factors of obesity, and one of the commonest causes of obesity, is inactivity. Most of our people are mainly riding motorbikes to wherever they want to go. They are mainly in the market, sitting down the whole day, and really activity is very low. And then we have got a population that is feeding on high carbohydrate diets. We eat a lot of rice, we eat a lot of potatoes, and our diet is basically just full of carbohydrates. So the diet of carbohydrates mixed with the inactivity naturally leads to obesity. And that is one of the things that is making diabetes and hypertension, which are two of the diseases that are highly related to obesity, very common in Kirinyaga County. So as one of our plans actually in the county, we have come up with a nutrition action plan where we want to go out into the community and educate our people on proper nutrition, because proper nutrition does not mean Western kind of nutrition. It means just eating healthy and getting what is right for our bodies. And of course, emphasizing on activity. Instead of people taking motorbikes, we would like to encourage our people to walk more and ride less.
Yeah, but that's rather interesting. I mean, what are you going to do? People stop eating rice. There's a lot of rice in Mwea. There's a lot of sweet potatoes and all of these things. I mean, it's an interesting challenge, and I'm trying to really understand how you're going to deal with that, because motorbikes are everywhere you go in Kenya. You find people now riding on the borders. It works. It takes you to the next place faster than you'd want to.
Yes, it is fast. It's a faster mode of transport, and it's a new mode of transport which everybody finds convenient. But I think if people understand the health risks of a certain behavior, they are likely to change.
Okay, like I said, yes, it's a good thing that we have representatives of the Kirinyaga population in the room, and we'll expand this conversation. But I wanted to explore something a little bit from a KEMSA perspective, Mr. Mureithi. We've had many cases of counties that get now I know they're called medical commodities, but basically drugs and all the other things that are used in all these hospitals, but don't pay in time. And from what I've been seeing, Kirinyaga appears to be paying in time. You don't seem to have too many problems with them on that score. What is that is working? What is different? Because then this could be a learning for other counties. What are they doing differently which makes them pay promptly, do you think?
Thank you, Joe. I must reckon that Kirinyaga County has very progressive leadership, responsive leadership that is committed to ensure that the health facilities in Kirinyaga has health commodities. I want to inform you that the leadership has increased the budgetary allocation for health commodities to 180 million from about 100 million. That's not a mean achievement. Having said that, in terms of our payments, we engage the county very closely, and the governor has taken personal commitment to ensure that KEMSA payments are prioritized. So what Kirinyaga is doing different from the rest of the counties is that they have prioritized health commodities, budgets, and payments.
Now, Emma, I was leaving you for last because I wanted you to hear from all these people who make policies and that sort of thing. And from a perspective of someone who works with communities, do you hear similar stories where people are saying, yes, all the local facilities out there are working, that there are drugs, everything that people need, that it is simply a question of perception, that people would come from different parts of Kirinyaga to come all the way to Kerugoya for treatment?
Thank you very much, Joe. In a community view, they feel that somehow we need accessibility when it comes to assessing the health services. Mm-hmm. They also feel that the quality that they normally get, it is not the 100% that they may need. Hence, they may need or they may require a bit of improvement when it comes to health service delivery.
So they feel that they don't get everything they want in the villages and the wards and everything, so they would rather come to a place where they might find something?
Yes, and at that particular time, we pose it back to the county government to look after the small dispensaries that are in the communities, that they may improve the health service delivery.
All right, great. So we are going to actually hear from some of the residents of this great county that are gathered in this hall, and my colleague Mashirima Kapombe is standing by to take us through that. Mashirima, please, let's get some thoughts, comments, questions from the floor.
Naam, Jo, watu wakiongea hapo juu kuhusiana na dhana kuwa zile ama vile vituo vya afya vilivyo karibu navyo havina vifaa vya kutosha. Nadhani David Madhenge ana kauli tofauti. David Madhenge.
Nashukuru sana. Kwa majina ni David Madhenge, na nataka kupongeza KEMSA na county government kwanza, kwa sababu kusema kweli mimi nikiwa assembly ya Kirinyaga, governor alisema lazima priority kuwe ni dawa, kulipa KEMSA, na pia budget ni vizuri tuambie wa Kenya. Tumejipanga na tumesema county government, the entire out of the 600 million development budget available, amesema the big four agenda ya president to prioritize universal healthcare, na tumehakikisha tumepatia Kirinyaga Hospital 400 million shilling ndio ikuwe upgraded to level 5. Pia tumesema Kirinyaga lazima ijengwe wards ya kina mama na watoto na Kembembe na pia Sagana, na tunataka kuhakikisha wa Kenya. Swali ilikuwa kuna promise tulipewa, tukaambiwa kuna KMTC tutapatiwa 2, moja ya Kirinyaga na nyingine ya Kirinyaga. Tunauliza Kirinyaga isikwe tu ni kupromisiwa, tunahitaji hiyo KMTC kuje na pia Kemri ya Mwea ihakikishe imejengwa.
Asante sana. Kuna John Joroge ambaye alikuwa na swali hapa kuhusiana na vituo vya afya.
Basi mimi naitwa John Joroge ama mtetezi kutoka Kiamutogo. Swali langu lilikuwa Kiamutogo hatuna generator kwa health center. Usiku wakina mama wakizaidiwa saa nyingine wanamulikwa na torch. Sijui hiyo itakuwa namna gani. Hiyo ingine nilikuwa nauliza, hiyo kama pia Madhenge anauliza, ile dialysis machine serikali ilisema italeta Kirinyaga na ingine Kirinyaga, ilienda wapi ya Kirinyaga? Ingine nataka niulize KEMSA, watu hawajui KEMSA ni nini, unless wacha wa elaborate what is KEMSA, tuelewe ni nini ili tuwe tunasema juu ya nini hapa.
Nadhani Jo, hayo maswali mazito yajibiwe kwanza ndio tuweze kuendelea kupata mengine.
All right, I'm already KEMSA ni nini? I think that is a direct question that we can dispense with before we come now to the other issues for the county government.
Oh, thank you, Joe, and thank you, Mtetezi, for raising that question. KEMSA is a government body, and KEMSA handles on behalf of the central government procurement, warehousing, and distribution of medical commodities. KEMSA has a mandate to partner with strategic partners. These strategic partners could be not-for-profit, could be international organization, could be the UN bodies, and we have signed strategic MOUs with strategic partners to ensure that we work together for the delivery of health commodities to Kenyans. For instance, if we talk about HIV commodities, I'm sure there's no facility in Kirinyaga that can complain that they don't have HIV commodities. Go to malaria, go to any other program commodities. We have ensured we work with strategic partners to ensure that those commodities are delivered and delivered to the point of care. And further to that, KEMSA is also mandated to enter into strategic partnerships with county governments to ensure that county government has requisite medical commodities at the point of care. So thank you, Joe, for that.
Yeah, but clearly maybe you need to do more to make sure that people like him actually know what to do. But thank you very much for that. Let's come to the county government. And there are two questions that have come from the floor. One about generator, dialysis machine, and also there was one up here about the Kenya Medical, I think, Training Institute, or was it? Yeah, KMTC in Kirinyaga and other places. Do you want to start? Or?
Yes,
okay.
I can start, Joe. And we want to thank you, the audience, for the beautiful questions. Let me start with the KMTC. The Kenya Medical Training College yes, the county government has been awarded from the KMTC national government 2 colleges. One is going to be situated at Kirinyaga Hospital, and the other one is going to be at Kirinyaga. The process is ongoing, and we have made quite advanced arrangements. So we have not it has not stalled. It is still ongoing, and we are going to ensure. And this is one of the things that I think Her Excellency the Governor promised the people of Kirinyaga, and it shall come to fruition. I can assure you that very soon we are going to start the construction at Kirinyaga Hospital, and then we shall be coming to Kirinyaga Hospital. Let me comment about the generator at Kiamutogo. One of the reforms that the county government is doing in ensuring that curative essential services are provided all over the county is to ensure that our health centers like Kiamutogo Health Center is operating 24 hours. And in this regard, we have actually procured generators for all the health centers that don't have generators, and they are undergoing installation as we talk. So very soon, Kiamutogo will not be having any problem with the power. And I hope our friend from Kiamutogo has been satisfied by my answer, with my answer. About the dialysis machines, we all know that Kirinyaga County Referral Hospital currently has 8 machines, which have been increased from a previous 5 machines. Now, these machines are working every day, 5 days a week, and we are offering services to about 80 sessions every week. 80 people are undergoing dialysis at Kirinyaga County Referral Hospital every week. And once we have established and fully utilized that dialysis center, we plan to establish another dialysis center. But at a point where we shall, or the site where this shall be established has not yet been identified. So it is upon the government to decide. Of course, with our good political leadership, the decision will be made at the right time, and the dialysis site we shall come to be installed. And
maybe I would want to add something, that the budgetary allocations that Kirinyaga County government has is also limited. We would really want to venture and go to every sub-county and do what we are doing for Kirinyaga. And as it is known to most of you, right now there has been a budget reduction by 150 million from the national government. That leaves only 600 million that is going to be used in terms of development. Actually, it is good even in these forums to put it that we are requesting the national government to reconsider giving us back that which they have cut. Otherwise, for us to achieve the proper utilization and commencement of the universal health care with budget shortfalls, it is very difficult. And we are really requesting not only this audience, but actually the national government that if we have to do what is required, they should reconsider giving us back that which they have cut.
All right, we need to get some questions from the audience, some more.
Na nadhani hapo Bwana Ndamberi amejibu swali ambalo David Gitari alikuwa nalo, lakini Florence Njadhi ana swali kuhusiana na NHIF.
My name's I'm Florence Njadhi. I reside at Kirinyaga. My question was on NHIF services. When we visit hospitals, NHIF services offer services to the people or employee to the county, outpatient services, but the TSC employees are not considered. Why? Thank you.
That's an excellent question. There's one more from Peter Karinga.
Okay, sorry, there seems to be, I think the question is not clear for the county.
Okay, let me just rephrase what she said. She's asking about the NHIF services that are available, especially to teachers, I believe. Yes. Karinga.
Nashukuru kwa nafasi hii. Kwanza ninataka kushukuru county government kwa kazi ambao wamefanya hadi wakati huu. Kongole. Swali langu linaenda kwa huyu mkuu wa KEMSA. Wakati ulikuwa na usema majukumu ya KEMSA, I didn't hear you say about camping, the supply ni kucamp drugs zile mbaya ambazo zinaingia kwa wananchi. What measures are you doing to avoid that? Kwa sababu slowly they are getting to the market. Thank you.
So you mean contraband and counterfeit drugs? Thank you very much. Tusonge mbele hapa, kuna mwingine hapa, Winnie Momanyi ambaye ana swali kuhusiana na wahudumu wa afya.
Thank you very much. Winnie Boyani Momanyi from Our Lady of Lourdes, Moya Medical Training College. My question is to the county government. What are you doing to motivate the healthcare providers?
Think you'll take those, Joe?
All right, so we will start here with Momanyi. What are you doing to motivate county health providers? As a matter of fact, there are even all those volunteers who are working out there, many of them doing critical work in promoting health services and helping people with education and all of that. What exactly are you doing? And I have seen Emma nodding, so I'm sure she will say something. But yes, let's start from Deputy Governor. Then you can help.
Okay. Thank you, Momanyi. I want first of all to state, and it is within the public knowledge, that the Kirinyaga County Government, the current Kirinyaga County Government, is in office for 1 year, and also working under very strict budgetary allocations. Having said that, we've already introduced a system whereby we are awarding the best performers within our facilities. And it is just a few days ago, about a week or two, when the CEC in charge of health and our staff were making these awards. Indeed, we are in collaboration with other public hospitals outside of this country, whereby we have gone to benchmark on how to award and support those who support the health facilities. And you'll be seeing many other things that are coming, whereby there would be monetary awards and also recognition from the county government. This we feel shall motivate people and bring healthy competition for them to reach there. We want our facilities to be more competitive than private hospitals. And you can attest to that by going to Kirinyaga or even our other facilities, whereby the PR itself has changed. When you look at the cleanliness of our hospitals, like Kirinyaga, Kabisa, you can see something has done. The environment, working environment, is conducive to our nurses and our doctors. Otherwise, a long journey starts with a step, and we are moving there.
Okay, Emma, you were nodding when that question was being asked.
Yes, because to my thinking, I was also thinking that the county government can push the national government to fund the medical facilities, for the medical trainings. Yes.
And the community health people, I mean, what is the state according to what you see?
For sure, much has to be done when it comes to the services that are being given. You see that even the nurses who are there, at sometimes they feel that the work that they are doing, they are not well appreciated. And at some point, you see them putting down their tools. And at that particular time, we believe that the county government is willing to take care of them and, of course, do something for them, just as that lady has said.
Okay, great. Mr. Moredi, the quality of drugs.
Thank you, Joe. I want to tell Kenyans that KEMSA is very, very, very serious about the commodities that are procured in terms of quality assurance. We have an elaborate laboratory that does testing of medical commodities that are procured by KEMSA. We do partner with National Quality Control Lab for confirmatory tests, should you want to have further testing being done by an independent body. Then we also work very closely with Pharmacy and Poisons Board, who are mandated to regulate the medical commodities in the market in Kenya. Anytime we are doing a procurement, we do evaluation of the tenders, and one of the aspects that we look at is the quality, and we would normally get samples from the bidders, and upon qualification of the bidders, and we have awarded you a contract before you deliver commodities, you give us a sample. We call it pre-delivery sample, and we will review that particular sample, and if we are comfortable the sample meets the quality specifications, then we will accept that particular commodity, put it under quarantine. Once it's put under quarantine, we will do further analysis, and if it is accepted by our quality assurance department, then the commodity will be put into use, and we will distribute to the counties and other public health facilities. Once we have done that, we do post-distribution surveillance. Once the product is in the market, to ensure that the product continuously meets our requirements and meets the specifications specified thereof.
But for people who are just going around to different facilities, how do they know this is from KEMSA, this is not? How do they know this one has been tested by KEMSA, it is not? That would be important, isn't it?
Absolutely. The assurance we want to give Kenyans is that we make a requirement from all suppliers that all products must have barcodes. Reason being, we want to trace that particular commodity. Should there be a complaint from the market, we'll trace the batch number of that particular commodity, and we'll get that particular commodity, do testing to confirm whether it was a KEMSA product or not KEMSA product. And then further to that, we also brand those particular products to ensure that once they are out there in the market, you can easily identify that these are KEMSA products.
Okay. Bwana Deputy Governor?
Yeah, I wanted to just add to what Murithi said from KEMSA, that us as the county government of Kirinyaga, we realize that there are so many quacks. People are going to China, to India, and bring drugs. And we cannot be able to certify that these drugs are the best, or we do not have a history about them. So that is why we came up with a program of dealing with KEMSA, because we can go back to them. And in our facilities, you will not find counterfeit drugs. And that's what I wanted to stress, that we don't have them because we are working through KEMSA, where quality has been guaranteed.
All right, Mashirima.
Kuhusiana na wale wahudumu wa afya wa kujitolea, yani CHVs, na nadhani afisa wa afya kutoka county alikuwa amenigusia kidogo ile mipango alionayo, labda naweza kujibu hilo swali.
Actually, for the community health volunteers, what we have come up with to appreciate the volunteership that they do to us, we have come up with a community health services bill that will be presented to the county assembly. And once it is accepted, it will have a component of a monthly stipend. We want to propose from around 5,000 to 10,000 Kenya shillings.
Asante sana, ni Daktari Murithi hapo. Lakini kuna Reverend Samuel Maina ana swali lingine kuhusiana na mipaka na swala la kupata afya ukipita mipaka.
Asante sana. Kwanza napongeza county government yetu kwa maendeleo ambayo yanaonekana, na niko na swali kwa governor wetu hapa. One is about solid waste management, and we know that both liquid and solid waste contributes to infections. Since independence, Kirinyaga County does not have any treatment planned. Is there any plans to address that? And then what are you doing as a county government to make sure our people are not going to neighboring counties for treatment in their hospitals? And you know, even a certain CEC was complaining about their resources being depleted.
Kuna Christine Njiro ana swali lingine kwa KEMSA.
Thank you very much. My name is Christine Njiro. I'm a resident of Kirinyaga town. And my question is to KEMSA. What are generic drugs? And are they the same as the original drugs? And are they as effective? The reason I'm asking this is because there are some insurance covers that insist that their clients only get generic drugs. So I think it's important that we know the difference. Thank you.
Asante sana. Swali la mwisho hapa kabla ya kwenda mapumzikoni ni Jerusha Wairimo.
Asante sana. Mimi naitwa Jerusha Wairimo. Nilikuwa nimeulizia mambo ya hapa Kirinyaga, hospitali Kirinyaga. Mambo ya ile ile ward iko ni moja tu, inalala na watoto na watu wazima. Kama tunauliza kama tunaweza pata ondi ingine kuna separate ya watoto na watu wazima.
Nadhani hayo maswali yanaweza kujibiwa kwanza.
All right, so we start with the last question there about Kirinyaga. Watoto wanalala pamoja na watu wazima, the same ward, that's what she says. There's also the question of solid waste management as related to the issues of health. You could start with those ones and we pick it from there.
Okay, let me answer the first one, solid waste management. As I have said, the county government with its mega allocations, already we have procured trucks and bins that are collecting all our waste. And we have dump sites whereby we are working on the waste. We have not gone to the very depth of having what we can call landfills, but at least we have centers where we carry our garbage and take to. If you can remember, by the time the county government under the leadership of Governor Waiguru came into being, all streets, all towns were littered. But today, you are witnesses that you have seen new trucks, new bins all over the county, collecting this garbage, taking them to garbage centers where we are turning them and thinking thereafter on how we can make much value from that. And I want to tell the questionnaire, whoever asked this, that as I said, a long journey starts with a step. Something has been done, and you can attest to that. And before I ask maybe the CC to talk about the Kirinyaga ward, I have heard also that question about other counties where there was some an MCA from a certain region who complained that many people are going for services in their counties. I want to say that as much as health services are devolved, we can never fail to support anybody who is not from within the county. Right now, the county government has set up Sagana Health Facility as an accident center to cater for people all the way from Keno going to Nyeri, because there is no other hospital that caters for people who go through accidents on that road. We are not praying that people go and get involved in accidents, but there is a need. And this is not only for Kirinyaga people. It is people going to Ishuru, to Nyeri, to Nanyuki, and any other places. However, Kerugoya Hospital has been a level 4. And as you all know, before Kirinyaga became a county or a district, those of you who have history, we used to have central province land from Nyeri. And we had a level 5 hospital in Nyeri and a level 5 hospital in Embu. So the facilities in Embu and Nyeri were a little bit above Kirinyaga County. And that is why people used to go to Embu and others used to go to Nyeri. However, with the systems that we have put in place, right now, the dialysis that is being done in Kirinyaga is catering for those regions, because we are actually second to Kenyatta Hospital. And within the new units that we are putting for dialysis machine, we expect to put one that is actually better than Kenyatta Hospital. And it will be the first best facility in this country. So I'm saying we are reaching somewhere. Don't say that this facility will only be attending to people of Kirinyaga. Even now, what we have in Kerugoya, we are getting people from other counties coming to Kerugoya. Otherwise, 80 people per week. Do not all come from Kirinyaga. Right. Some are from the neighboring counties.
All right. Thank you very much. Dr. Gachoki.
Yes. Joe, allow me to just try to take us back to the question on motivation of our healthcare workers. And I want to say that motivation does not come just in monetary ways. There are many ways of motivating healthcare workers. And one of the things that we have done is improving the environment in which they are working. That is one of the motivating factors. When you're working in a clean, nice environment, you feel motivated to work even more. The other things that we also do in terms of motivation is allocating budget for them to go for training, to go for conferences, and we offer them continuous medical education. So there are so many things that we do that we don't, people maybe don't shout about, but all that is geared towards motivating the healthcare worker.
Now
Even making, sorry, okay.
Okay, I'm sorry I'm rushing you, but yeah,
there's
the
the next
question
question.
of the wards that are shared between children and adults.
Yes. Kirinyaga Hospital is one of our sub-county hospitals. And everybody in the county knows that we are in the process of upgrading all our county, sub-county hospitals. Kirinyaga is one of them. And we are currently putting up a maternal and child health unit, which is going to be to have inpatient facilities for mothers who are going for antenatal clinics and also for those who are going for deliveries. Now, we also plan to put up a ward that will help us separate the children and the female.
Any timelines?
Probably in the next financial year, we should be done. So we are doing these changes slowly by slowly to ensure that our curative services are going down to the people of Kirinyaga.
Okay, generic drugs before we finish.
Thank you, Joe. For universal health coverage to be a reality, there must be efficiency. WHO recommends the use of generic drugs. Reason being, branded drugs are pretty expensive. And the branded drugs are basically innovator molecules. And innovator molecules can be almost 50% more expensive than the generic drugs. So in Kenya, we have adopted the essential drug list by WHO, and we call it the Kenya Essential Medicines List and Kenya Essential Medical Supply List. We have an equivalent one for lab commodities. So we are guided by the essential drug list, and we do procure generic drugs, not because they are not effective. They are very effective, but basically because of affordability. In this country, we've had issues with prescribers' preference, in the sense that you find some prescribers choosing to prescribe branded commodities, which are pretty expensive, which does not add value to the poor Kenyans that we are. Having said that, we have entered into strategic partnership, again, with innovator manufacturers through what we call access programs. And access programs is where we negotiate with the innovator manufacturers to give us a discount on those particular commodities, let's say for diabetes, hypertension, and we normally get sometimes 60% discount. We pass that benefit to Kenyans to the extent that my mother in a village in Kiboro in Kirinyaga can go and procure those, can get those particular commodities at Kirinyaga, Keruguya District Hospital or Keruguya Referral Hospital. Same medicines that she would go to Nairobi Hospital and pay, say, 70% more.
All right. Thank you very much, Eliud Murezi.